The Bauchi State Zero-Dose Learning Hub Community of Practice (COP) visited some primary healthcare centers to inspect cold chain facilities, its utilization and routine immunization services in compliance with the recommended immunization accountability framework, considering that the state has 13 zero-dose local government areas. The visit, led by the Bauchi Local Government Health Authority, was part of activities for the fourth quarter review meeting organized by the African Health Budget Network. The COP members visited Yerwa Domiciliary PHC and Lushi Health Post, where they also reviewed how primary health care services are provided, including the Basic Healthcare Provision Fund services, where they discovered that the Lushi Health Post lacks cold chain facilities and thus rely on Yerwa Domiciliary for its vaccine storage. The team's facility-based supervision was to ensure adequate utilization of all budgeted and released funds and to identify possible gaps that can be remedied to improve immunization and other PHC services. African Health Budget Network State Focal Person Dr. Hassan Shaibu Musa charged members of the COP, especially directors of PHC and the local government teams from the zero-dose local governments, to be steadfast in engaging their respective local government chairmen and other colleagues at the local government so that immunization-related challenges can be identified and resolved early. The fourth quarter review meeting, he noted, was also an opportunity for the COP to develop an immunization financing scorecard, review budget allocation and release per quarter, and to track immunization budget implementation in the state in the year 2025. The chairman of the COP, Director Disease Control and Immunization State Primary Healthcare Board, Dr. Ademo Mohammed, and the co-chair, Mr. Jinjiri Garba, expressed optimism that the immunization financing scorecard will put all stakeholders on their toes to put more efforts to achieve more sustainable accountability and track real-time progress per quarter in 2025 with a view to supporting zero-dose local government areas and underserved communities and on timely universal immunization coverage in the state. The African Health Budget Network, in consortium with African Field Epidemiology Network, AFINET, is implementing the Zero-Dose Learning Hub in Bauchi, Sokoto, Borno, and Kano State. The Zero-Dose Learning Hub Community of Practice is a multi-stakeholder body comprising of academics, professional bodies, civil society organizations, youth groups, representatives of persons with disability, and traditional leaders who came together to review immunization financing landscape in Bauchi State. The Bauchi State COP had played a prominent role in terms of advocacy to critical stakeholders that led to the allocation of 872 million naira to fund immunization activities in the state. The COP had undertook a similar exercise in Ganjua local government in the third quarter of 2024, which all aligns with AHBN's efforts in ensuring advocacy for improved immunization, budget allocation, tracking and accountability to ensure sustainable immunization financing in Bauchi State. Elizabeth Ka, BATV News.